Hi, I'm Sharon Racusin and the host of Voices for Justice. The goal of this show is to allow social and economic justice activists give you an opportunity to get organized and connected to the important struggles happening in our community and in our state. You're not alone. Join us. Healthcare is a human right. Hi, out there in TV land. I'm here with Sarah Rosenstein, a third-year medical student at Geisel School of Medicine in Hanover. And in this program, we're going to talk about the immigration issue and the pressure that people are under to get health care in this country and when they're sent away from this country. And it's very relevant to this moment. Sarah was born into advocacy. It seems she works at WISE, volunteers there. She's volunteered at the federally qualified health centers in Vermont and Corinth. She's a member of Med Students for Choice, and spent some time at the end of last year in Tijuana at a tent city. And we're going to talk about that experience that you had. So why don't you start? When were you there? Exactly.
So I was there in the end of December of last year. I was spending Christmas break with my brother who lives in San Diego, and I couldn't just relax for a Christmas break. I said, I'm close to Tijuana and there's a caravan that has just arrived here, so I want to go down and help with the medical care that is being given there. This was before any aid had come in from the United States, so the people in tent camp were seriously lacking in care, and I knew that that was somewhere that I could help out. So I spent some time down there when I was in San Diego, working with an organization called Border Angels, and they were the first organization to go down and provide medical care into the camps in Tijuana.
So who were those people that were there? Did they come north and just stop there?
Yep, so they had come north from Guatemala and El Salvador, mostly, and they had been denied access into entry into the United States. The tent camp, the caravan previous to them had tried, and that was when we saw family separation starting to happen. So there was a lot of unrest with this caravan, especially for people who had children that they didn't want to cross the border because they were afraid they'd be separated from their families. Additionally, there were a lot of people living in these tent camps who had been deported from the United States into Mexico. And so they, after being deported, didn't have a place to go, so they were staying there as well.
So why don't you tell the audience what the conditions were like and what the conditions of the people were?
Yeah, so there were tent camps of about 2,000 people when I was down there, and the conditions were pretty horrifying. The tents were just out in the open sun on concrete, and you saw people just laying there looking desperate with nothing to do. There wasn't enough sanitation, so we had people who were just urinating and defecating right on the streets outside of the tent camp. It was essentially a public health emergency waiting to happen. And so that's also something that we were trying to prevent. There were a few separate camps. So there was one main camp that was mostly men. There was a camp for women and children, and then there was an LGBTQ camp as well that I worked at. So they were kind of spread around Tijuana, and the conditions were not great. I saw a lot of people with severe medical conditions that needed emergent care, quite frankly, and they weren't getting it.
Who set up the tents on the side of the border, on the southern side of the border? Was it the Mexican government? Was it the people?
I think it was the people themselves. Yeah.
Wow. I mean, I want people to understand how, I want it to be graphic. I'd like you to, there was a story about a trans woman, and you might, these are the kinds of situations where people are requesting asylum. They need asylum, and they're denied because of instances like Sarah's going to tell you about this trans woman.
Yeah, so I saw several instances of people who needed asylum and also medical care and were not getting either because they were being denied asylum, essentially. So I had the opportunity to work in the LGBTQ safe house for an afternoon, and they had to have a fully locked down safe house because there had been some violence on LGBTQ members of the caravan from people within the caravan and those in Tijuana, and so they really weren't safe there. There was one trans woman who actually was seeking asylum because she was escaping violence, and she had been beaten so badly that she had to have multiple bones in her face reconstructed. Her external wounds had healed on her face, so she just had scars on her face. And so when she went and tried to seek asylum, they said that they needed proof that there had been violence, and they needed her to get special x-rays of her face and skull in order to be granted asylum. So she obviously didn't have the means to access an x-ray where we were. And so that left her in limbo, running from the violence she had experienced, but not being able to reach asylum in the United States. So she found herself in this safe house in Tijuana, unable to leave or do anything, waiting for someone to help her get x-rays of her face.
Thankfully, there was a safe house.
I'm really grateful for that. Yeah. The week before I went, there had been 2 murders of LGBTQ members of the caravan, and so it was really important that they got a safe house. And that was just someone in the community who was nice enough to offer her house to these people. So.
It's ironic that everybody's escaping from some horrible situation, but there's still division.
Yes.
That
I know.
Is just astounding.
Well, when you think about it, you have people who are escaping violence, but then if they have any other intersections that make them more marginalized, like being a member of the LGBTQ community, their safety is even more of a concern.
Right. And then there are people like this man who came to the country as a child and was deported.
Yep. I met a man who had grown up in the United States, but he was deported after an ICE raid. And he was in Tijuana. There's one shelter in Tijuana that offers people who've been deported from the United States 2 days to stay to figure out where they're going to go. But he had no family to go back to, so he found himself living, his whole family was in the United States, and he found himself living alone in a tent camp in a country that he had not grown up in, not knowing where to go next. So
yeah.
It was really heartbreaking. Yeah. There were a lot of people there who were in desperate situations. I saw a woman with a high-risk pregnancy who had been denied asylum, and she was going to try to cross the border the next day, and I gave her the medicine that I could. She had preeclampsia, and needed to get to a hospital, and we sent her with all the medicine we could, and I don't know what happened to her. I don't know if she was able to reach the asylum that she needed, so.
And you recently read a story about a diabetic.
A diabetic who'd been deported, had lived here most of his life, and didn't speak the language.
Didn't speak Spanish.
Yeah, of where he was deported to, and then
Oh no, well, what?
I think it was in the Middle East.
Okay.
And he wasn't able to get his insulin there, and he died from that because he didn't know how to access care in a country that was essentially foreign to him, having grown up here all his life. So the intersection between healthcare and immigration is huge. I mean, we see it in just the camps that are on this side of the border, right? We have children dying in those camps, and, you know, even not dying, they're still living in conditions that children are not able to thrive under. So, and I just woke up to the news this morning that the Trump administration is trying to lengthen the limits that families can be held in those detention centers.
That's right.
Yeah.
I just heard that as well. And then there's the news about green card holders, people who have been here with legal status. If they pose any medical, if they have any medical needs, and they're on Medicaid, they will be denied. They could be deported. They're being targeted as using something that is a human right, medical care. They're focusing on the people who have the least to give and don't have a voice. They're already probably scared to death that any wrong move and they'll be out of here with no questions asked. But in fact, in this country alone, in this country, we have people who are being cut from Medicaid. They are being denied access. They can't get access. They have no dental care. And actually, you know, just chipping away at Medicaid is what this administration and previous administrations, Democrat or Republican, want to do.
Yeah.
No help from the government.
It's certainly not just an immigration issue, right? So working at the East Corinth Federally Qualified Health Center, I did see a lot of people who didn't have insurance, maybe were hardworking and were making just enough money to be above that Medicaid cap, but that doesn't offer you a lot of wiggle room to buy plans that cost $100 a month and still live. So yeah, it's not only immigration, but it's a problem with immigration that we're seeing right here too. So my preceptor at the FQHC worked with some of the rural migrant workers in Vermont. And we had to go to them to give them health care because they were too afraid to come out to get health care because they could be reported to ICE at any time. And so we have an organization working in this country who is ready and waiting to deport people, whether they're trying to send money home, grocery shop, get medical care, and it's horrifying.
Right. I mean, they were just 3 or 4 dairy workers were at Walmart and were picked up while they were sending money home and doing normal things that people do, shop. And I think 2 of them were deported. And this this is not the country we want to live in. This is not the country, this is a country that doesn't even give its citizens health care or takes care of people. Their mission is to get you off of welfare, and welfare is necessary.
Yeah. To be a productive society,
Yes.
we need to all support
Right.
each other.
And the cap that when people work really hard, and it may be a low-paying job, and you need 2 or 3 jobs to eat, buy clothing, rent, get the basic necessities of life. We put a cap so that when you reach that cap, even though it's not a lot of money and a lot of income, you basically have to struggle even more after that. I was talking to a woman that I know from Germany, and she said, we have a welfare system. When people make money, we still help them. We don't let them fall off the cliff. You gradually cut back, but to say, you've made, I don't know, $15,000 this year.
That's about right.
That's about it. And if you make 1 penny more, you receive no help. And so what this administration is doing with people who have legal status and they have green cards, they don't have a voice. They're pushing them to the brink. And what is going to happen? They're going to end up in the emergency room when there's a life or death situation.
Yeah, so we see that a lot. The burden on the uninsured is to seek out their primary care in the emergency department. That poses a few issues. Number one, that means that people aren't getting preventive care for anything. So they're not seeing a doctor for regular checkups, checking on their health, so they develop chronic conditions easier. And then those chronic conditions become acute, and we see them in the emergency department, which is putting an incredible burden of expense on the healthcare system that could be avoided by providing basic primary care services to everyone. So it's actually more expensive to let people wait. I'm trying to make the argument from a more conservative side. It's more expensive to wait and let people end up in the emergency room and become hospitalized than to take care of their basic health needs in the first place. We would have a healthier population who would be more productive if we took care of the basic primary needs of everyone, and they didn't have to go without and develop primary conditions that become acute and require emergency department help and hospitalization. That's a huge cost.
Right.
It's much more cost effective to treat people from the start before they develop these chronic diseases than to wait until they're in an emergent situation and need high-level care.
Right, and that expense trickles down through the profit-making insurance companies and the business-oriented hospitals that are not for profit, supposedly. They have to recoup that money. Indigent care is expensive, especially when the many people need that emergency care.
Yeah.
And we've pushed them, this country has pushed them into that situation.
Yep.
Forcing immigrants with legal status in this country to say, if you pose, if you're going to use Medicaid money now or in the future, how you figure that out, I don't know. We're not going to let you stay in this country. I mean, I think that's the premise. And this is the most cruel policy that can be devised. On top of that, every human being requires everyone, rich or poor, immigrant or citizen, needs health care services at some time in their life.
And we have the ability in the United States of America to provide that to everyone who is here. Yeah. And we have a global case study showing that that's possible in all other developed countries. Everyone is able to access health care. They spend less money, they're healthier, it's possible. But what I think sometimes we forget is that we're living under a government who doesn't have those priorities, and in fact is openly racist and classist. And so, you know, what their goal is to get as many people out of this country who aren't like them as possible. We have concentration camps at the border holding families right now. We're extending the time they can be held. It's fascism and it's a crisis. And I think that needs to be in the forefront of all of our minds, that this is not okay. We can't let history repeat itself again. The amount of violence that's taking place in this country right now is astounding. And so it's affecting healthcare for citizens, non-citizens, but really the bigger picture is that we're turning into a nation who says that these things are okay. And I just want to make sure that, you know, people know that we're heading back in a really scary direction, healthcare or not, and I personally am trying to do everything that I can to stop this while also being a medical student, and I think it's citizens' responsibility to say, no, this isn't going to happen again here. We can't put people in camps again here. And I'm not just talking about Nazi Germany. We've had people in camps here before, Japanese people.
That's right.
So that's a part of our history that we hide a lot. But we can't be putting humans into concentration camps. We just
and denying them their basic human rights.
No, healthcare and otherwise.
Thank you for that assessment, and we'll continue this conversation.
That sounds good.
Thanks, Sarah.
Thank you, Sharon.